Doctors of Reddit, what's your thank God they came in for a second opinion moment? Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. I can't count how many I was told it was a headache, but I just wanted to come in and have it looked at in case it was something else I've seen. Of course, those are the patients that are the nicest and are profusely apologizing for wasting our time, and of course, those are the patients that have a brain tumor show up on their CT scans. Oh God, where to start? I literally just admitted this lady to ICU. Had been coughing for ages, 60 pounds weight loss, smoker for 50 years. Now she can't breathe and I got a CT 6 cm mass, looks very suspicious for lung cancer. And the doctors for 4 years throughout this just gave her vitamin D, E, even though she was losing massive weight and coughing up blood. Another guy who came in looked pale as a ghost. Chief complaint was fatigue. One lab test later found out his hemoglobin was 4, barely on the cusp of survival. Seems like he had iron deficiency anemia for YRS. Doctor gave him some iron, he got better, but no one looked into why he got it. Number 1, 2, 3 reason in an older guy is colon cancer. He died 4 months later from metastatic colon cancer. Another story: last month was about to take a long trip across the Pacific. 1 hour in on the flight they ask for a doctor. I volunteer myself. I see this lady literally gasping for air, like waving her hands in the air cause she can't breathe. Look through the meds, she's obviously an asthmatic. Listen to her lungs and faint wheezing, no air movement at all. I later grounded that plane because there was another 16 hours to go and she was on verge of being intubated. Later I get more story from family member. Apparently she wasn't been able to sleep well for past 2 weeks. Doctor just gave her sleeping meds, more and more of it. Told her flying no problem. I asked the family why can't she sleep? Is it because she wakes up in the middle of the night gasping for air, classic sign of uncontrolled asthma? They're like, yes, how did you know? Sleeping meds prob among worst things she could have gotten, and almost killed the patient by saying she could fly. People who get diagnosed with bronchitis, when they have heart failure and literally drowning in fluid. There are doctors who give antibiotics and steroids for everything, especially when they have no idea what's going on. Maybe I'm biased because I work at an academic center, so I see all the cases who get referred in because they're too sick or no one can figure out, but at least a few times a week I'm like, wow, this person could have been saved or not end up this way if someone cared enough earlier on. I'm going to say this as a doctor. It's honestly scary every day how many patients I see are completely mismanaged. Some doctors in urgent care see like 45 patients in a day. How is that possible to be thorough? Like if only patients knew what the doctors missed or whatnot. Half the time I really think it's like going to a bad auto shop and not realizing they're just making half the shit up. Same thing happens in medicine, and except people's lives suffer because of it. Edit added a story. Thank you to whoever gave me silver gold. Let me say something, people are saying I'm Gregory House or something. I'm not. I purposely didn't choose stories that were some esoteric diagnoses. Everything I picked is like bread and butter, medical student level. Half of being a good doctor is knowing what questions to ask. Sometimes you don't even know what's important or not. The other half is caring. Too many just put a band-aid on the problem and punt the patient to someone else. Is it the doctor's fault? I don't know, but I do know the medical system in the US provides no incentives for doctors to actually practice good medicine. In fact, I bring in less money if I'm thorough versus I do the same thing every patient and see 100 patients a day, which is what some do, unfortunately. I have tons more stories, hopefully I'll get to share some more, but for now have to sleep. Can I go ahead and speak on behalf of my doctor? 19 meters at the time, I felt sick for about a week, flu-like symptoms, didn't want to eat, just felt bad all over. One day at work I feel a very uncomfortable cramp tear in my abdomen, so I go to one of those 24-hour clinics. At this point I'm slumped over, can't stand up straight without insane amount of pain, just generally uncomfortable and hating life. After a few hours at this clinic, they say, you probably have kidney stones, go home, drink fluids, sleep it off. This seemed fine to me. I was ready to go home and listen to the doc, all was good. But my girlfriend at the time wasn't a fan of this prognosis and drove me to the ER, against my wishes of course. After a few minutes at the ER, they determined my appendix has ruptured and I'm going septic. Apparently I was pretty lucky to not have died, though I did pick up bacterial pneumonia while in the hospital, so the recovery kinda sucked. Now I just have a crazy 6 to 7 inch scar on my belly to remind me to not avoid hospitals when I'm sick. A bit of background, in my field of audiology we have people licensed to diagnose not only hearing issues but balance disorders and other factors impacting listening and understanding. We also have another field who popped up when it was not considered as ethical for us to treat those more serious hearing issues, i.e. with hearing aids, but they don't need the same doctorate level training, just barely high school or some college depending on jurisdiction. So I had a patient come in with a serious difference between left and right hearing, and this in itself is considered a red flag because both ears are exposed to the same things over time, and there are very few explanations as to why one would get so bad. The patient could hardly understand words on that bad side, and the better ear was pretty good overall, just minor hearing loss, perhaps age-related. Immediately upon seeing these test results, the aunt and I agreed to send this patient for an MRI of the head because something was off. The patient confirmed no MRI or medical treatment had been recommended in the past and only hearing aids by this lesser-trained hearing aid dealer, working for a popular U.S. chain. The patient had been wearing these hearing aids already for a few years. The MRI results came back. Massive tumor on the hearing nerve. The hearing aid dealer is being investigated currently for malpractice, or more specifically a violation of state laws regarding red flags. Edit, since a few of you are asking what happened with the patient, I'll paste what got buried below. I don't usually get to see these cases if they get sent for surgery. I'm not in a big metro area, so the very specialized ENTs, neurotologists, have their own audiologists to handle post-op testing. Anticlimactic, I agree. I am a semi-retired physician and I don't believe in second opinions. I much prefer 2 first opinions. Not a doctor, but remember reading something related in another thread. Pete1729 said, here, https://www.reddit.com/r/askreddit/comments/1hwof9/doctors_of_reddit_case_of/closing parenthesis:. Greater than my girlfriend is an doc. A hippie-type guy came in a week after a bike accident. He'd been treated and released by another hospital. He was complaining of some neck pain. She immediately had him backboarded and ordered X-rays. Greater than the X-ray tech called her and asked why, when he had been treated across town, were they X-raying a guy who was obviously indigent. Greater than, because his neck is broken. Okay, greater than she was right. If he had tripped on a doormat and fallen, he would have likely been paralyzed. Greater than I like to remind her of this one when she's had a hard night of fighting off drug seekers and attention. I got a moderate traumatic brain injury in October, and the week after I got home from the hospital I wasn't acting like myself, was refusing to eat and just didn't make much sense. My mom called the doctor a few times. They said it was normal but to take me in if anything changed. She took me in on the Saturday a week later because I started slurring my speech and was unsteady on my feet. The injury caused my sodium levels to drop from 140 normal to 119. This in turn caused stroke-like symptoms, which were in reality a series of small seizures. I am not a doctor. But when I was 9 or 10 I started having swollen joints after a vacation in Sweden. The swelling would get really intense and weirdly switch from one joint to the next without a sensible pattern. After a while I also started experiencing extreme fatigue and odd, red splotches appeared all over my skin. Next came the digestive problems. Anything I ingested would just be vomited out a few minutes later. This situation worsened until I even started puking without having eaten anything at all. My parents were at a loss and obviously terrified since I was getting worse by the day. We went to several doctors who all told us that it was nothing to worry about since I had a history of being allergic to mosquitoes and bees, and since we had been to Sweden they thought it must have been the several stings I got there, causing a severe allergic reaction. My mom fortunately wasn't satisfied with this diagnosis since everything they prescribed proved to not be helpful whatsoever. After a while, it felt like weeks, of being bedridden, feverish and in a hellish amount of pain. She found a doctor for me who specialized in autoimmune diseases. He diagnosed me with Henic Schonlein purpura, https://en.m.wikipedia.org/wiki/Henic-Schonlein_purpura, and told my mom to get me admitted to a hospital right now. I don't remember much since they put me on so many painkillers and I was asleep most of the time I was there, but the doctor told me that the disease had spread to some of my vital organs and that I could have died if my mom hadn't brought me in that day. Thank you, Mom.